This is the second part of sleep apnea. This was preceded by the first part, which explained what sleep apnea is and the importance of treating sleep apnea. It also discussed both surgical and non-surgical methods available for treatment. It carefully explained that sleep apnea differs from simple snoring or mild sleep apnea, which is more of a social problem. This does not replace the one-on-one consultation or the careful discussions the surgeon may have with you. Please always talk with the surgeon, ask any questions, and have it all answered prior to proceeding. Before surgery, please discuss any health conditions that you may have. This includes background medical concerns, any chronic pain syndromes, any addiction to painkillers or any other substances. If you take any blood thinning medications, please inform the surgeon, as you cannot have this operation if you have any bleeding disorder. It's important that you organize yourself time off, stay close proximity to the hospital, organize yourself help, ask all the questions that you have, and have a good understanding prior to proceeding. After surgery, you will be looked after by a team, not only by the surgeon. If it's in the public hospital, there will be a public team looking after you, as I'm not always available in the public system and I may not necessarily be the surgeon on the day. On the private sector, I will be the surgeon and there will be most likely a physician or the anesthetist looking after your pain and assisting us in your management. I will also be seeing you regularly. The first day after the operation in either hospital will be in the high dependence unit. Thereafter, you'll be admitted to the ward for further observation. The ward admission for 1 or 2 days will be important, as it will give you more of a home environment to understand how things are, how to take the painkillers, and also allow time for any questions to be answered. When you go home, it's important that you do not travel up to 4 weeks after surgery until it's safe to do so. Avoid any long hot showers or any strenuous activity. If any bleeding, you need to proceed emergently to the local hospital that we discuss, and also to have any help available. It's important that you don't sleep alone, have someone else in the room or the house with you. Essentially, have sufficient help. It's important that you understand pain management and have all the questions answered before you proceed. The consent itself involves understanding your condition, understanding that you do have other surgical and non-surgical methods available, and also the risks of the procedure and the treatment. And also it discusses complications. It, however, is not an exhaustive list of every possible complication that could occur. We have done our best to make you understand your procedure and the risks and benefits as well as we can. Any surgery carries risks. Tonsillectomy alone can be painful, but tonsillectomy and the barbed repositioned pharyngoplasty, where it lifts the palates up, can cause more discomfort. It requires opiate pain medications as well as steroids to try and reduce the swelling. If you have any concerns in regards to any of these medications, please inform the surgeon. There is a small risk of infection and early suture extrusion. Bleeding may occur, and a small risk of return to theatre may occur. Risk of a life-threatening event, a bleed or an airway emergency, is exceedingly rare. It's not dissimilar to perhaps the risk one may take going on a long road trip. There are risks, but we try to manage things carefully as possible with all the explanation and safety protocols in place. There's a small risk of damage to surrounding structures, the taste or swallowing. Once again, with the modification of technique, these risks have significantly reduced over the years, but not absent. Damage to the tongue, nerves or blood vessels can lead to altered movement, taste or sensation. Again, by placing the channels in the correct position in predetermined safe areas, we minimize the risks. But once again, the risks are not absent if you're having surgery. By now, we have covered the diagnosis, the possible outcome of surgery. We have explained both surgical and non-surgical treatment options available. We have talked about the procedure and the side effects and possible complications of surgery. We have discussed some details of surgery. We have given you a chance to ask any questions. After having done that, you will be requested to sign a consent form and also obtain any other surgical information that may be required for your admission. Signing the form does not mean that you must proceed with surgery. Should you wish to have non-surgical options or change your mind, please inform the surgeon. Thank you.